I'm Mary Olson. I'm a community volunteer with Tri-County Rural Health Network, and I've come to appreciate the partnership between Tri-County Rural Health Network and the College of Public Health. It's a partnership that is rich because we each bring our own expertise, we each bring our own strengths, and so together we are much stronger than either of us are alone. For example, our main programs, our main expertise is the ability to connect grassroots citizens with resources, hiring grassroots leaders. But in order to show the effectiveness and cost savings of our work, we need fancy, very sophisticated evaluation programs, of which I certainly would have no knowledge, and I doubt anybody else in the community would either. But UAMS has the very sophisticated researchers and the technology and the know-how to evaluate a program so that it can show cost savings. So without our ability to reach grassroots citizens with trust and results, the program would be nothing. But without the evaluation of UAMS, we would never be able to show, and people probably wouldn't believe, that we were really making a difference. When you put the two together, we can show that we are impacting people's lives and we are saving dollars. So the two work together hand in hand. We started with a grant because people saw that grassroots citizens were not accessing health resources. So we began by doing a community assessment, asking the questions, and people said, look, we've got the resources here, we just don't trust them. Scott will talk more about that. And so we put together a program. We put together the program after doing deliberative democracy forums with grassroots citizens, asking them what was needed in the community, what were the strengths of the community. And then UAMS saw what we were doing. And after this program, Naomi Cottams, it's really her brainchild. She put it together and heard what the citizens were saying and conceptualized it. Then UAMS took a look at it, and the College of Public Health said, we would really like to be able to evaluate that because these kinds of programs so often go out when grants go out, and this was a grant-driven program. And to be really sustainable, you have to show you're making a difference. So it was a community-born program, community-designed with the grassroots citizens. And then UAMS came in and said, we will evaluate it. That's far different than many research institutions who want to come into a community, tell you we know what you need, and then they come in and try it out, and we never trust them, and so they leave and nothing has changed. With the College of Public Health partnering, again, to make us stronger, it was a good fit.
The concept, one last question, the concept of deliberative democracy that y'all have used really well in terms of access and, I guess, building trust level with grassroots folks, but also with other service providers as well.
Right.
How does that work, and how has that benefited the work?
Thank you. Deliberative democracy is the process we use for bringing grassroots citizens together so that grassroots citizens can participate in finding the answers to challenges in the community. And even if they don't agree on the results, they can all work together in many different ways to achieve a stronger sense of community. The people who are at the forums are the experts. This is not a time when other people come in and tell people. This is a time when the community itself, grassroots citizens, and by grassroots I mean people living at or below the poverty level, come together and agree, come to some consensus, some common ground on what should be done and what they can do, we can do about it, so that we're all working together on it. doesn't become a question of what if some outside medical experts come in and do it. It's what we can do. We're now working on a project of how we build a community-built health system so that it's the community, when we as a community decide to end disparities, they'll end. As long as it stays in the Ivy League towers of UAMS, nothing will change. But when the community itself decides it'll change, the community will, then they will invite the experts in where it's needed. But that's quite a different concept of partnership than one in which the people with the academic knowledge have the answers and the community are the recipients of the answer. This is a case in which the partnership really turns that on its head, and the community becomes the place of expertise, and the UAMS, the institution, becomes the place where they are invited in for specific points where their expertise is helpful.